surprise.
Right. Well, after those squeals of delight, we'll get right into it, will we? I'm joined by the Treasurer, Wayne Swan, and by the Minister for Health and Ageing, Nicola Roxon. And first and foremost, can I just start by marking that it is Pink Ribbon Day for breast cancer. As people are probably aware, around 1 in 9 Australian women will get breast cancer sometime during the course of her life. So today is the day we wear the pink ribbon to remind Australian women to have the health checks that they need, and of course to remind all of us to look after those in our community who are suffering with breast cancer and the family and friends that love and care for them, to make sure we're providing our support to those family and friends. And today we are actually talking about health, and I'm here to announce that this week the government will introduce landmark legislation to reform the structure of the nation's health system. Now, this is going to be the first time that a level of government, the Commonwealth Government, will take majority funding responsibility for public hospitals and full responsibility for the funding of primary care. Now, this change is the foundation stone for our health reform agenda, and of course our health sector is now the nation's biggest employer. Australia's hospitals are getting busier and busier every year. Our population is ageing, and so that puts pressure on demand. There are more chronic diseases than ever before, and that puts pressure on demand. And yet, when we look at the Australian government funding of hospitals, prior to this government, it was in free fall. Now, this legislation will reverse that. It will ensure that the Australian government, the Commonwealth, permanently pays 60% of the efficient cost of each and every hospital service. It will mean that funding for hospitals services will keep up with demand. That will help ease pressure on waiting lists in emergency departments and for elective surgery. It will mean that the Commonwealth, as the dominant funder, will be able to set new standards for hospitals which will apply right across the country. And because the Commonwealth will be responsible for most hospital costs, we will be able to invest in services outside of hospital as well, primary care and prevention. So we will obviously have that responsibility and the right incentives to invest in prevention and primary care to keep people out of hospital, because it is the Commonwealth Government that is paying the majority share. Now, for many years, Mr Abbott, as Health Minister, actually mused about 2 reforms for the hospital system. He never got either of them done, but he used to muse about the Commonwealth taking over funding for hospitals, and he used to muse about imposing strict, transparent standards on the states as a condition of receiving increased national funding. Well, this legislation actually delivers both. So the test for Mr Abbott now is whether he will support this legislation as it goes before the Parliament, and it will be introduced this week. I'll turn now to Nicola Roxon for some comments.
Thank you very much for that, Prime Minister. Obviously, as a government, we're very pleased that we are introducing this legislation this week. The Treasurer has, I'm sure, some comments to make, having gone through the negotiations with the states and territories. Remember that this legislation means for the first time the Commonwealth will be taking on a 60% share of funding. And in the past decade, of course, the time when Mr Abbott was the Health Minister, as well as the time when he was in Cabinet, the Commonwealth's share of funding for hospital services dropped from 45% down to 38%. So this legislation is the first time that we will be guaranteeing a fixed share of hospital funding into the future. And of course, we're taking this step based upon the evidence. Many of you will remember, many of you having travelled with us while we got expert advice, while we went through community consultations, and while we negotiated with the states and territories to get agreement to this change. But of course, this also is an important part that builds upon significant investments that are going into the health system. a 50% increase in hospital funding, negotiated at the end of 2008 when we first came into government, but also, of course, our $7.4 billion health reform package, which sits on top of that. Record investment in hospital services, including the delivery of 1,300 more hospital beds. Training of more than 5,500 GPs over the next decade, and of course more nurses, more practice nurses, and hundreds of extra specialists going to rural and regional areas. Expanding primary care facilities with small infrastructure grants for more than 400 GP clinics, but an additional 28 new GP clinics across the country, and of course our world-leading preventative health measures, such as our introduction of plain packaging for tobacco, which is aimed to reduce smoking levels and take pressure off our hospitals long term. So the legislation is really focused on us making sure that we will improve the sustainability and the efficiency of our hospital system. And it means, as the Prime Minister mentioned, that we can leverage our investments in hospitals using strong national standards, improved transparencies, new levels of accountability. And I'm sure that the Deputy Prime Minister will want to make a few comments about how this also means we can hold our state colleagues to account, ensuring that every dollar that we invest is going to health, and every dollar that they allocate for health is also spent on health. A vital change which has been achieved through our negotiations of this agreement earlier this year.
So we'll turn to Wayne. Too early in the morning for you, Mark Riley? You're right? Good, thank you, no problem.
Thanks very much, Prime Minister. Thanks very much, Nicola. Look, this is a very significant reform of federal-state relations, one of the most significant reforms of federal-state relations in decades. But it's also a very significant reform in economic terms. It's about getting value for money, about getting value for every health dollar that we spend. So the legislation that is introduced this week will particularly go to the core of federal-state relations. And we have to go back to what we're doing here. What we're going to do is fund 100% of primary care and aged care services, and 60% of the efficient price of every public hospital service provided to public patients, as well as 60% of recurrent expenditure on research and training in public hospitals and capital expenditure. Now, the efficient pricing mechanism is very important here. That's the way we get value for money. And to do all this, around 1/3 of GST revenue will be retained by the Commonwealth and invested in the National Health and Hospital Funds in each state. And this means we can start reversing that decline that has taken place in Commonwealth funding of public hospitals over a long period of time. What we're now going to do is really significantly invest in our public hospitals with our state partners, but make sure we can get value for money. And of course it means that we will relieve the states of $15.6 billion in growth of health costs from 2014-15 to 2019-2020. So it is a significant reform of federal-state relations, but a significant economic reform as well.